Movie theater mayhem, crazy cat disease, and that's not compatible with life. Probably. Today, we are breaking down and reacting to all of the hilarious medical scenes and ridiculous injuries from Scary Movie. Let's dive right in. Oh my gosh. Stab wound to the abdomen is a non-specific hit going through the abdominal wall, hitting through the omentum, and then it's question where in the abdomen are you getting hit. You divide the abdomen into 4 quadrants, and then you know anatomically what organs are there. Stab wound to the right upper back. It could be just below the shoulder blade, going directly into the lung, so you can increase the risk of a pneumothorax, hemothorax. Probably have a collapsed lung with bleeding all around that. You're going to be short of breath. Laceration injury to the left side of the neck. If it was midline, there's not a lot of vascular structures there. There are some blood vessels, but not big ones. On each side, underneath your sternocleidomastoid, which is that big ropey muscle here, you have your internal jugular vein and your carotid arteries.
Shorty, are you okay?
Shorty.
Talk to me.
Oh, drooling could mean multiple things. Is there a substance on board? Is there a head injury? Is somebody having a stroke? Is there a peripheral nerve abnormality? Is somebody having Bell's palsy?
Morphine? Chloroform? Horse tranquilizers?
Typically, when we hear horse tranquilizer, probably is related to ketamine or phenobarb or some other type of barbiturate. These are still medications that we actually might use at a hospital.
You drugged him!
I did not. That's all his stuff.
Oh my gosh, he does have a malformation, probably a genetic malformation of his right hand that is very small and not fully developed.
Take my hand!
That usually happens in utero, within the uterus as the baby is being formed.
No.
Yep.
Beet juice in the house. This is your brains on drugs.
Opening up the skull and there's no brain in there. I mean, the character would not be able to speak, talk, be alive, anything like that.
Hey, who was that? Go ahead, do it again, do it again.
Oh my gosh! Penetrating trauma right through one ear, out the other. So you're going straight across. All your major, really important structures are inside, deep inside the brain, at like the brainstem and just above that area, which is right where that would traverse through. The likelihood of being alive through that is probably pretty low.
Oh, hey.
Ah, cute little cat. If your day ends in a full-blown confrontation with your cat, or anyone for that matter, your nervous system may need a little support. That's why I created Chillax by my company, Life Happens, designed to help support relaxation and calm racing thoughts. Check out Chillax at lifehappens.com or Amazon. We do see people come into the emergency department with animal bites and cat scratches. You know, you've heard of cat scratch fever. The issue with cats and their bite wounds is they have very sharp, long teeth. So they actually embed the bacteria from their mouth into your tissue, and it's really hard to clean out. Inevitably, a lot of these end up getting infected. Sometimes the cat or any animal can scratch deep enough and you may actually need sutures. Typically, if it's a laceration like this, we will clean it out really well. We will monitor you closely. We don't always have to throw antibiotics into your system. We see people who get glass bottle injuries, lacerations from it, or embedded with glass. Really hard to get these types of foreign bodies out of the body. Sometimes we'll actually have you follow up with a surgeon to do what's called fluoroscopy, which basically is a continuous x-ray to be able to see where the piece of glass is and get it out of there.
Come on.
If somebody hits you in the face like this, cat or human, have some bleeding that could happen when your teeth hit the mucosa on the inside. You can have a tongue laceration, you can bite your lip, all things that we would look inside somebody's mouth to just make sure we can identify where the bleeding is coming from. Sometimes we need to suture things closed if there's a big defect. Woof. We we always make sure that if there's a laceration to the lip on the outside, that you close the vermilion border and approximate that first, which is that line going all the way around their lips. That needs to be perfect to make sure that there's no visual abnormality. That's where our eyes are drawn, so we always close that up first.
Sweet, sweet Brenda. She looks so peaceful.
That's messed up. I don't know if you know this about me, but my family business was funeral homes. They actually have specific schooling for individuals, makeup artists, or prepping a body for funerals or wakes. Putting the arms down and hearing that crunching, nasty noise. Something called rigor mortis sets in when you pass away. Usually if the paramedics get on scene and they notice that rigor mortis is set in, they're not going to do resuscitation on the individual.
I believe they just leave it out here like this.
George, it's awake.
Awake? Brenda, it's a miracle.
Oh my gosh.
Nothing.
Oh. Massive compression to somebody's chest. The big smack to the chest isn't done very often anymore, but we would call that a precordial thump. If somebody actually has a witness arrest right away, you can actually hit somebody in the chest hard enough, it causes enough electrical impulse that it could actually restart somebody's heart. You're not doing mouth-to-mouth resuscitation at the same time that you are doing chest compressions. That's not how you do it. It's 15 and then breathing, then 15 and then breathing. Caskets are padded, so you're gonna have a lot of give on the opposite side. Typically when we're actually doing CPR, especially CPR in the hospital setting, we actually are gonna put a hard board behind somebody's back. That way you're pushing on something hard versus like a soft hospital bed, because the compressions are not going to be as effective. You're not slapping patients in the face to see if they wake up. We don't do that. We do occasionally do a painful stimuli to assess somebody's alertness. A sternal rub with your knuckles, compression to the nail bed, which is uncomfortable. You're not trying to hurt an individual. You're just trying to see if they would respond. Oh my gosh. You don't see any bleeding, because typically what ends up happening is after somebody passes away at a funeral home, they will actually embalm somebody. Most of the time, not everybody. They'll take the person's blood out, fill the body back up with embalming fluid, which actually preserves the body. Scary movie. So I haven't seen this in a very long time, and it's a spoof scary movie, so they kind of make fun of all the other shows, but they do a good job, and there are some funny medical scenes here. So if you guys enjoyed this and you want to see more, just let me know in the comments, as always, and definitely check out this playlist right here, binge watch everything, and please make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.